get you walking again soon?
That's good.
I can depend on you.
Coming through.
At the Bondi Clinic, little 8-week-old kitten Coco has arrived in the arms of his anxious owner, Robert.
Okay, so just explain what's happened.
The dog walker found her under our dining room table.
Yep.
It's got a V leg.
Yep.
She was lying upside down with her head stuck between the legs of them.
Wow, okay.
And we don't know for how long.
Yep.
We left home at about 9, so
Yep.
this was about 12:30, so...
And so it could have been anywhere up to 3 hours.
Yeah. My real fear is that she dies, and I have to explain that to two kids that have gotten to really like her a lot. Well, don't really know what we'll do then.
And when she was actually freed, what did she do?
According to the dog walker, she collapsed. She
Yep.
went completely limp. And then when she put her down, she just couldn't walk.
At first glance, Coco isn't in a good way. She's been wedged in that table leg for anywhere up to 3 hours. And my worry is that in the effort to try to free herself, she may have actually done more damage.
When you have two bars pushing in the side of your neck, you can get a situation where either you have all the blood going to your brain but not being able to get back from it,
Yeah.
or you have not enough blood going there in the first place.
Yeah.
Did she have fairly straight eyes before?
I don't know.
The thing is, this left eye is deviated off to the left, whereas the right one is in a normal position.
Yeah.
Look, structurally, the rest of her feels okay.
To be honest, if you ignore what's happened to Coco today and ignore her age and just look at the symptoms she's showing, what we're looking at here are the classic signs of a stroke.
I can feel a little heart racing quite quickly there at the moment. So what we need to do is just try to reverse this sort of semi-comatose state we've got at the moment. So my feeling is that her brain's gone through some sort of shock there, which is now affecting the rest of her body. What I'd like to do is do two things. First of all, get her on some oxygen just to help stabilise her, but also give her something for the shock, something that's going to take away any swelling that she might have on her brain.
My hope at the moment is that it's just exhaustion from her trying to free herself from that table leg. But the big concern is obviously she may have a serious brain injury.
You okay there? I'm just going to sleep over here.
At the Bondi Clinic, Chris is giving little Coco oxygen to try to alleviate the effects of shock.
Coco's body is essentially playing tricks on her. It's panicking, which means she's taking shallow breaths, and shallow breaths just aren't effective enough.
The kitten has been found unresponsive after being found wedged in a table leg.
She's taking deeper breaths there, which is good. The issue we have with shock is that it's essentially where the body starts to shut down. It panics and doesn't have a normal distribution of the blood supply and also the oxygen in that blood supply. The positive sign at the moment is that Coco's taking deeper breaths. We'll find a way to actually decrease the pressure on her brain and actually allow her to fight off the shock she's currently experiencing. So she's breathing a bit more easily there. I might just set up the X-ray and get a quick shot.
In struggling to free herself, Coco could have injured her jugular, arteries, or worse still, her spinal cord. An X-ray will allow Chris to check whether the bone structure is still intact.
X-ray!
Okay, so I've just isolated that area around the neck that was actually stuck between those table legs. So what I'm looking for are any signs of any fractures or any areas of extra swelling that just shouldn't be there. All the critical things for survival are all in this one zone and they've all been crushed. So it gives you a great indication about why you're entitled to be so concerned. All our vertebrae are in place and we've got no little bony pieces coming off to the side there, so we've got no fractures. The only damage we must have in this neck region is soft tissue damage. My feeling is when those bars pressed in, it meant the blood flow was still able to get to the brain, but it just wasn't able to drain away through the veins. That meant essentially the blood pressure within the brain got really high. If that pressure inside of her skull has become too much, then there's always the risk she could have had a bleed, essentially had an aneurysm inside of her brain, and that could explain the signs we're seeing in her right now. Okay. How are you feeling there? It was the play session that went wrong, wasn't it?
At the Bondi Clinic, Chris is closely monitoring little Coco, the kitten found wedged in a table leg.
The biggest concern I've got is that what Coco is essentially facing at the moment is a strangulation injury. By being stuck between those bars, pushing on the sides of her neck, the artery flow would have been strong enough to force blood up into her brain, but the vein, being a lower blood pressure, would have meant that it never drained out. So she could actually have had a massive pressure build up inside of her brain. If that has occurred, then there's always a risk of something like a stroke occurring, a bleed inside the brain.
That's it.
Coco has been given oxygen and anti-inflammatories.
The next few hours are quite critical to see exactly how she recovers, because if it's simply been a matter of her being stuck for a little while, being a bit stressed and now becoming a bit exhausted as a result of that, then she'll begin to improve fairly quickly.
Coco's owner, Robert, has been anxiously waiting for news.
So she's just here, she's just on oxygen there. Yeah, she's doing okay.
The little kitten also has two other special visitors, Robert's daughter Kira and friend Ariella.
How you going? So I'm Chris.
Hi.
Nice to meet you guys. So you've obviously heard what's happened. So she's just resting here at the moment. You can see she's not too aware of what's going on around her at the moment. But what we're trying to work out is whether that's just because she's very tired, because she's had a very big day, or whether she may have actually done herself some damage. We're doing the best we can. I know she's doing the best she can as well. I promise you I'm not going to rest until we see some sort of sign of improvement from her. After seeing Coco's family this afternoon, clearly there is a lot of love for her out there, and hopefully that does count for something. My wish is that over the next 12 hours or so, with some extra rest and with some more time for those drugs to take effect, she really does turn a corner. But at the moment, there's no way of knowing if that's going to happen. There's a lot of people at home that want you home as soon as possible. All right, Coco. You're a funny little thing, aren't you? We might just use this chance while those eyes are open to have a look in there, just see what sort of response we're getting from the pupils.
At the Bondi Clinic, Chris is looking for any sign of improvement, however small, in little Coco.
Okay, yep, so we're getting a response there. If there's one thing that's worrying me, it's the fact that Coco still doesn't have much awareness of what's around her, and that's a really big hallmark of a brain injury. If there is one positive, it's the fact that her pupils are actually responding to the light. But it's been 6 hours since the accident and she's still not really showing too many signs of awareness and is still in that semi-comatose state. I would have hoped by now that we'd be starting to turn a corner and be starting to see some more positive signs. But you have to remember that Coco's young and today has been a day like no other.
Alright. You're alright. That's it.
Chris is now concerned about the 8-week-old's hydration levels.
I mean, it seems strange that just a few hours ago we were worried about almost too much blood pressure, and now we're trying to replace that fluid in her system to make sure she doesn't become dehydrated. So it's just the challenge of looking after small kittens. Things change very quickly with them. All right, so she's now going to stay well hydrated. She's got those drugs on board from before. I think we're probably okay to actually give her a cage to rest in now.
Yeah. Okay.
Coco will spend the night under observation at the clinic.
Okay, Coco. Welcome to your little hotel. So what we need to do is something you're very good at. Yeah, which is sleeping. My hope is clearly that today's just been a massive day for her, and the reason she's so unresponsive is because she's simply exhausted. I'm not sure if I'm being too optimistic in thinking that, but hopefully with, say, 6, 12 hours, we'll start to see some more positive signs from her. See you later. Won't be too far away. What did you do with that kitten that couldn't keep its eyes open? Where did she go?
At the Bondi Clinic, overnight rest has seen a remarkable improvement in little Coco.
What did you do with that kitten that couldn't keep its eyes open, huh? When I first look at Coco, I'm almost tempted to scan her microchips to make sure this is the same kitten. And overall, it's chalk and cheese, isn't it? We're dealing with a different kitten this morning. You do see this with kittens. Their metabolic rate is so fast, things move so quickly in their body that really, if you can give them half a reason to heal, quite often they will take it. So if you can see it, I'm guessing, when I do this, which I know you don't like, you're going to wince up a bit, aren't you? Yep, here we go, nice little blink. Pupils are constricting, it's good. It doesn't look like much, but for her to be seeing where I'm moving that white light around and eventually trying to swipe at it, that is the best sign we've seen from her in the last day.
And now there's only one thing on the little battler's mind.
Thank you. I need that. Yeah. For patients that are as severely affected as Coco was, we usually withhold food. I use that a lot. Yeah? But now, given the fact she's showing these signs of improvement, it's time to see just how hungry she is. Normally, kittens, they chew their food before they swallow it, not just inhale it. Don't want to talk right now? I think that's enough food for now. Stomach of yours is bulging. It was hard not to get caught up in the emotion of yesterday when Coco's family came and visited. But now, the really positive thing is I get to call them up and give them the good news. You said you would have to get better. And could you pull through for everyone? And look what you've done. You just will keep on doing what you're doing. Yeah. You're looking good, aren't you?
At the Bondi Clinic, a miraculous turnaround in Coco's recovery means she's finally able to go home.
Chris phoned me today and said she's much better. She was jumping around. She bit his finger. Yeah.
Coco's excited family can't wait to be reunited with their extra special little girl.
Last night at home was very quiet. We gotten used to a little cat bouncing around. She's quite a nocturnal cat, so she usually wakes up at about 2 o'clock in the morning and goes for a run around the house. So it was odd not having her there.
Hello, guys.
Hi, Chris.
How are you?
Good.
Good? Do you want to come with me?
Yeah.
I think everyone remembers their first pets and remembers just how much they meant to them. So I was never going to be the guy that had to tell those kids that Coco wasn't going home. So there's someone that's demanding an urgent meeting. What do you think?
Coco.
What do you reckon? You're a pretty good judge. You know her pretty well.
Yeah.
How is she doing?
She's purring.
Yeah?
She's better.
So you're the vet here now. So what do you think?
Much better.
Much better.
Yeah. This isn't the Coco we saw yesterday, right?
No.
Yeah.
She's made a big improvement overnight. Ultimately, she just needed some time to relax, to rest, and try to get everything back on track. But as you can see, I don't think she's back to 100%, but that's a lot to expect within a day. There's no doubt that the brain is by far and away the most complicated organ in the body, so it makes sense that it's going to take multiple days, even weeks, for Coco to re-establish those connections, those pathways that allow her to jump around, to leap around like a normal kitten does.
So the big question for us, does she come home?
You're pretty keen, right? This is where it becomes very hard for me, because how do I say no to you guys? How about we make a deal?
Okay.
So she can go home,
Yeah.
but she can't play with you guys too rough, and I'm led to believe she may play with the dog.
Dog, yeah.
So you can't let her play with the dog for a few days.
Yeah.
So there's nothing more to do than hand her over.
There we go, Tiki.
She's all yours. Good luck.
Thank you.
Thank you.
As the owner of a kitten that has a similar personality, I mean that when I say good luck.
Thank you.
You're obviously going to have some very good times coming up.
Okay. So,
Yeah,
lots of adventures. The
Yeah.
adventures of Coco.
absolutely. Yeah. I've got no doubt that this is the first of many adventures for Coco, but hopefully it is the most serious. And from here she does actually mature. She learns to behave just a little bit, because there's that loving family that cares for her a lot. And I'm sure right now they can't imagine life without her. Hello, Owen, hello.
Hey, Chris.
How are you?
How you doing? I'm
It's
good.
very good to see you.
Good to see
hello.
you.
How you going? I'm almost nervous to ask. Where is she?
She's hiding
She's hiding.
under there.
And As for little Coco, she's finally recovered from her nasty fall a month ago and is back to her mischievous self.
Oh, look at you. Butter wouldn't melt. When Coco went home, we were all very much aware of the fact it was going to be a long recovery. So I'm keen to see how she's changed. Wow. Oh, little Miss Sensitive. Has she mellowed?
No. No, she's as energetic and full of adventure as usual.
Yeah.
Started climbing everything in the house, up and down, wherever she can go. Loves the garden.
Yeah.
And loves climbing trees.
Climbing trees now.
Yeah. Coco loves heights. She climbs all over the house, climbs onto funny places. Coco's been stuck up a tree 3 times now and requires somebody to climb the tree to go and fetch her and bring her down.
So this is the famous or infamous table?
It didn't come with the socks. The socks is the new safety feature
Wow.
to keep her out. But that's where she got her head wedged down there, and the socks are now there too, so that she doesn't slip down and fall.
But it seems so innocuous, doesn't it? I mean,
Yeah.
you look at that, you would never think that a cat would get their head stuck in
No.
that, but it just shows you, doesn't it, when they're so adventurous,
Just, yeah.
anything's possible. Trees, tables, huh? And health-wise, how's she going?
Fine. She's picking up weight.
Yeah.
Normally, she's nearly doubled in weight since we've had her.
Yeah.
Just a little play with your neck here. Yeah. It's feeling good. It's not catching anywhere. There's no resistance to that. The neck is moving nice and freely there. Importantly, those eyes are nice and open and certainly pointing straight ahead. Has she been clumsy at all since?
She was, when she just came back, she was clumsy for quite a while.
When she stood up, she just start walking full over.
But every day, you can actually nearly by hour see the improvement coming through.
I mean, it's interesting because what you describe is exactly what someone that has a brain injury has to
yeah.
go through,
Yeah.
is essentially teaching themselves to learn to walk, learn to have that coordination back,
again,
and teaching the brain to function in a normal way. And it shows you how serious it was for her. To see Coco today, it's so heartwarming to see how much she has recovered, how she is now back to normal, clearly enjoying home life. And it feels amazing.
Hi, I'm Dr. Danny Dusek from Bondi Vet. If you love our show and want to see more, plus some amazing content about pets and how to care for them, hit the subscribe button. Click that little notification bell and we'll see you on our next video.